How can new biomarkers detect gluten sensitivity? Imagine being able to tell if someone reacts to gluten without relying on traditional tests that can sometimes miss the mark. That's where new biomarkers come into play. These are special signals in the body that can reveal gluten sensitivity even when standard tests don't show clear results. They help distinguish between celiac disease, which is an autoimmune disorder, and non-celiac gluten sensitivity, which involves different immune responses and symptoms. Gluten sensitivity means your body reacts negatively to gluten, a protein in wheat, barley, and rye. Symptoms can include stomach pain, fatigue, headaches, or skin issues. Celiac disease is diagnosed by finding specific antibodies in the blood and damage in the small intestine. But many people feel symptoms without having celiac disease, making diagnosis tricky. That's why scientists are working on biomarkers that can give clearer answers. One promising biomarker uses HLA-DQ, gluten tetramers. These are molecules that attach to gluten-specific immune cells called T cells. If these tetramers find gluten-reactive T cells in your blood, it suggests your immune system is reacting to gluten. This method can detect immune responses even if you are on a gluten-free diet, which makes it very useful. Another approach looks at T cell receptor sequencing. This technique reads the unique patterns of immune cell receptors that respond to gluten. It can identify immune signatures linked to gluten sensitivity and help diagnose the condition through a simple blood test. For non-celiac gluten sensitivity, researchers are measuring intestinal damage markers like intestinal fatty acid binding protein. When the small intestine is damaged by gluten, levels of this protein increase in the blood. Elevated levels can indicate gluten-related intestinal injury, but without the autoimmune features seen in celiac disease. Detecting gluten immunogenic peptides in urine or stool is another innovative method. These are tiny fragments of gluten that your body excretes after eating gluten. Finding these peptides confirms gluten ingestion, which can be helpful for people on a gluten-free diet trying to track their gluten exposure. Advanced techniques like proteomics, transcriptomics, and metabolomics analyze proteins, gene activity, and metabolic products in your blood or tissues. These methods can reveal subtle signs of gluten-related inflammation or metabolic changes, even when traditional tests seem normal. All these new biomarkers are still being researched, but they hold great promise. They could make diagnosing gluten sensitivity more accurate, less invasive, and faster. This means people with symptoms that don't fit the classic celiac disease profile might get answers sooner. It also allows for more personalized dietary advice, helping people manage their condition better. As these tests become more available, they could transform how we understand and treat gluten-related health issues.